So many of you had asked about metabolic syndrome. So today's topic is on metabolic syndrome. So I've got many concepts put together, and the source of these would be, like the renowned Medscape journals, yes, for the recent criteria and all, and Harrison's endocrinology, right? So this is what is about the sources and little bit contents from here and there. Yes. So metabolic syndrome, what is metabolic syndrome? This is actually a constellation of metabolic abnormalities, right? So that is what's metabolic syndrome. So metabolic syndrome, something is dealing with this metabolic abnormalities. So there is a constellation of metabolic abnormalities, and that put together is going to increase the risk for cardiovascular disease and diabetes mellitus progression. So that is what is the a significance of metabolic syndrome. So there are certain criteria. If you find at least one or two criteria in a patient, you have to think of metabolic syndrome. You know how significant this metabolic syndrome is because it is going to increase the risk for cardiovascular disease and diabetes mellitus. So all the metabolic abnormalities, and it is going to cause all your metabolic disorders. This is also called as syndrome X and insulin resistance syndrome. So as it says, insulin resistance is what we are going to focus in metabolic syndrome pathogenesis, right? So this is what is about the importance of your metabolic syndrome. So to learn in deep on metabolic syndrome, you must know what is the definition, yes, or the diagnostic criteria. And there were so many organizations and there were so many bodies that defined metabolic syndrome with definitive criteria. But we should follow what is the most commonly followed is what is this NCEP ATP3 criteria for metabolic syndrome. So that criteria was that three or more of the following stuffs should be present in any patient. Then you must think of metabolic syndrome. You must evaluate and you have to monitor them. So what are they? First one is waist circumference of more than 102 centimeter in men and more than 88 centimeter in women. This is what is the first criteria. Then you have your fasting triglyceride level. It should, if it is more than 150 milligram per deciliter. So more than or equal to 150 milligram per deciliter of your fasting fasting triglyceride levels. Then you have your blood pressure level. Blood pressure level when it is more than or equal to 130/85. Then HDL cholesterol level if it is less than 40 in men and less than 50 in women. Yes, that should raise the suspicion of metabolic syndrome and you should evaluate the women. So less than 50 itself is considered to be a criteria for metabolic syndrome, remember. Then fasting glucose level of 110 milligram per deciliter or higher. Yes. So this has been changed to 100 milligram per deciliter to reflect the revised criteria for impaired fasting glucose. Okay, so 110, 100. So this is what is the recent one here. So how do you just remember? You remember with the help of this mnemonic. VE, yes, weight expanded or the waist expanded. Okay, so waist circumference is 1. Then impaired glucose tolerance is IG, and H1H is for HDL, the other H is for hypertension, and T for triglycerides. So just for you to remember because this criteria is what is most commonly used. So how do you make a diagnosis when you find 3 or more of this criteria? Yes, 3 or more of this parameters, then you would diagnose this metabolic syndrome. So please remember waist circumference, triglyceride level, blood pressure, cholesterol, fasting glucose. So we are going to revolve around these concepts only again and again. Yes. So the other criteria also I would like to mention because we have certain differences here. So the one is WHO criteria for metabolic syndrome. So they say the patient of with they have a risk of type 2 diabetes. So the patient with type 2 diabetes, then impaired fasting glucose. Is the voice breaking? Is it the same for others? Yes, the internet is perfect for me. Please leave and then join back. We will see. Right. So there is type 2 diabetes, then impaired fasting glucose when it is in the pre-diabetic range, and then impaired glucose tolerance, the glucose level of less than 200. No, right. So glucose tolerance, yes, the voice is not breaking, it seems. Please leave and rejoin again. So impaired glucose tolerance when the glucose level is 140 to 199 milligram per deciliter postprandial. So after 2 hours, after giving 75 grams, you have, I'm audible, right? Yes. So type 2 diabetes, then impaired fasting level of 101, 125 milligram per deciliter. Then impaired glucose tolerance also, that also they're taking, that is postprandial, okay, 2 hours after administration. Then you have glucose uptake level of less than lowest quartile of ethnic population under hyperinsulinemic euglycemic conditions if the fasting glucose level is normal. So there is something called as the hyperinsulinemic euglycemic clamp test, which is considered to be the gold standard for measuring insulin sensitivity. Okay, so that also we'll be seeing in the further slides. So this is, you are giving insulin as you are giving insulin also IV, then you're giving glucose also IV, then you are checking what is the ratio of insulin that's necessary to maintain euglycemia in the patient. So whenever there is insulin resistance in the patient, then you would require more and more insulin to uh, develop this euglycemic level. Yes, so but if the insulin is sensitive in the patient, then you would require only just adequate amount of insulin to maintain the euglycemia. So that is what is about this. So you have the so that is what is about this test. So what is the level of glucose uptake? Okay, what is the level of glucose uptake? So the level of glucose uptake, if it is going to be less, even if you are giving more and more insulin and the level of glucose uptake is very less, yes, which is again how reflected by hyperglycemia in these patients. Okay, so if it is going to be very level of glucose uptake is very less, even if you're giving more and more insulin, then it means that the patient is suffering from some insulin resistance. Yes, so that is how this test is performed. It's a gold standard test for measuring insulin sensitivity. In addition to these, the diagnosis must also include two of the following. Again, these following criteria is similar to that of the NCEP criteria, wherein you have blood pressure, yes, with minor changes. Blood pressure more than 140 systolic, more than 90 diastolic, or higher, or both of these. Yes, and use of antihypertensive medication in a patient. So this is one important criteria. Next is triglyceride level more than or equal to 150 milligram per deciliter. Then you have cholesterol, HDL cholesterol less than 35 in men, less than 39 in women. Then you take BMI. So in NCEP, we are taking waist circumference, but here in WHO criteria, they're taking BMI. BMI when it's more than 30 kg per meter square. Also waist to hip ratio more than 0.9 in men, 0.85 in women, or both, right? In addition to all these, what is the new extra criteria that the WHO is taking? That is the urinary albumin excretion level. So they are also checking for microalbuminuria. Yes, they are also checking for. They please. Okay. So they are also checking microalbuminuria here. So microalbumin, urinary albumin excretion of more than 20 micrograms per minute, or albumin ACR, albumin creatinine ratio of more than 30 milligram per gram of creatinine. So this criteria also they are taking. So this reflects the endothelial dysfunction also, right? So this is what is about the WHO criteria. Next, when you see AACE clinical criteria, okay, so this is also one important one. Here they are taking BMI of 25 kg per meter square or higher, triglyceride level, HDL level, BP, and glucose. Here again, the glucose they are taking into consideration both the fasting as well as the postprandial. And additional risk factors, they will look for family history of type 2 diabetes mellitus, hypertension, coronary heart disease, polycystic ovary syndrome, then sedentary lifestyle, advancing age, then ethnic groups who are at higher risk for these type 2 diabetes and coronary heart disease, right? So this is about your AACE criteria or your ACE criteria. Now, what's the difference? Now, the difference in these diagnostic criteria, you see this AACE criteria and WHO criteria are taking 2-hour postprandial levels also. In addition, WHO criteria is taking microalbuminuria into consideration, right? And NCEP is taking the using only the fasting glucose level. All right. So this is what you have to know about the differences here. Because this WHO and ACE criteria is taking this postprandial also, it is taking fasting as well as postprandial. So which means that it is the OGTT test that they are doing, yes, oral glucose tolerance test, because they're giving the 75 gram of glucose, after that they're taking, right? So that one, because they are doing that, whoever is at risk of endothelial damage due to this hyperglycemia will also will be picked up in this when you are actually doing this oral glucose tolerance test. So that is one added advantage in this OGTT test. So this is about the differences. Now you also have something called as this IDF global consensus statement. So they have also proposed the criteria which has also been uh, talked much. So in this global consensus statement, it's an international diabetes federation. So they have given a worldwide definition of this metabolic syndrome. They are actually they want to early detect, yes, whoever they have to pick, they want to pick up patients so that they don't uh, progress to this cardiovascular disease or type 2 diabetes mellitus. So they want to pick up patients even more and give intensive management for the condition so that they reduce the long term risk of cardiovascular disease and diabetes. So according to the definition of this, the it includes central obesity. Yes, it includes central obesity that's defined by this waist circumference more than or equal to 94 centimeter in men and more than or equal to 80 centimeter in women in this selected population. And also ethnic specific levels are there. Along with waist circumference, the two other criteria should be satisfied. One is this triglyceride level more than 150, HDL level less than 40, less than 50, BP, and then fasting hyperglycemia. As you can see, this is similar to your NCEP ATP criteria, right? In that there were the 5 criteria and they said three or more of the criteria you have to diagnose. And this IDF also is like, they say waist circumference is a must. With waist circumference as a must criteria, 2 other criteria of these 4 things have to be present. Then you will diagnose the patient to have metabolic syndrome. Clear? So this is all about your different criteria, of which at least you have to know about the NCEP ATP3 guidelines, right? So that's more important. And knowing this also, it's kind of easy only, right? IDF. So WHO, what's the difference? You should know WHO and ACE criteria are taking postprandial glucose into consideration. So they are actually doing this oral glucose tolerance test. And you can see your WHO criteria is also taking urinary albumin excretion into account. So these differences also, if you know, it's well and good.